November. It's a time to honor those who provide care to people battling terminal illness or disease.
It's recognized as National Hospice and Palliative Care Month. Our Ellie Bird shows us how to get this care if someone in your life needs it.
Dr. Adam Tyson is the medical director for palliative care at UT Medical Center. He wants people to know the difference between hospice and palliative care.
Hospice is focused on end-of-life care. To even qualify for hospice, you need a physician to say they anticipate you might only have 6 months or less to live.
Palliative care is unique. It's care given to a patient with a serious illness or even a broken arm. Dr. Tyson is an advocate for palliative care because he saw firsthand how it changed the outcome for his son who battled cancer as a toddler.
Made a really significant difference, both in his quality of life, but they made us feel the most cared for. Amazingly, he survived the cancer treatment, which is fantastic, but that difference that they made me really want to go into palliative care.
His son still receives the care because his cancer left him with a brain injury. Dr. Tyson says palliative care should be introduced as soon as the patient is diagnosed to start helping their needs along the way.
A really good illustration of how this can help is someone who has cancer and maybe they're going through chemotherapy. We know chemo can cause a lot of side effects. If those side effects are being really well treated, then you might be able to go through more treatments. We have data from heart failure patients who even go on hospice and end up living longer.
Most hospitals across the country have this type of treatment, and it's covered by Medicare, Medicaid, and other insurances. Dr. Tyson says this helps people living in rural areas or people who don't have family to help because their team goes all over East Tennessee.
That's the prevailing attitude in palliative care. We want to understand people, who they are, where they're from, what's important to them, how do they make decisions, and then we focus on what's important to them. And most patients will tell us what's important to them is they want to feel better.
In Knoxville, I'm Ellie Bird, WVLT News.
And we do have more information for you on palliative and hospice care inside the WVLT News app.